the hour of doom
and bloom.
That's right, friends and neighbors. Welcome to the Doom and Bloom Survival Medicine Podcast, a fortress of fortitude in an unfortunate world. I'm Joel MD, that old Dr. Bones, and I mean old, and I am the founder of doomandbloom.net, a survival medicine website with over 1,300 articles, podcasts, and videos on medical preparedness.
And I'm Amy Alton. I'm an advanced registered nurse practitioner and a certified nurse midwife, and I'm also known as Nurse Amy.
That's right, and she's the hostess with the mostest, the purveyor of quality medical kits over at her store at store.doomandbloom.net. And she's so hot, she still can't build a snowman down here.
Well, we're in South Florida, so it's not really possible anyway.
Well, that may be a factor, but she's pretty hot. Now, what you're watching
Speaking
here...
of hot, this thing keeps your coffee super hot.
Yes, Yeti. It's called Yeti, which is funny because it's the same name as our microphone.
That's true, but it's not the same company, I don't think.
I don't think so either.
I don't think so.
What you're watching here is an experiment. We're going to see if this video podcast is going to cure my Alzheimer's disease, otherwise known as old-timers disease. I am losing brain cells at an alarming rate.
Me too.
No,
it's okay.
not you.
Yeah.
You're young.
Yeah, no, we walk into rooms and we're like, why did we walk in here?
I have done that many times.
How many times today have we done it, though, already?
Once I've done it once. I will do it
I did it
more
once
often
today, too. I did, too.
So this is a drastic measure. We're going to see if it cures me. You're going to give it a try. I should let you know that this is a clinical trial, that our first video podcast was there. It was meant to be an experiment to determine if being exposed to us and our videos is lethal. And it turned out it is not lethal to actually watch our videos. That's right. This is now our second trial, or second podcast, where we're going to try to find out if exposure to us makes you nauseous. And so hopefully...
How about it turns on our printer?
It turns on... Who is printing something?
Nobody pushed anything. Our printer is printing randomly.
Okay. It might be
you
a
know
message.
what it's printing? It's printing the information for the show.
Oh, okay.
So I'm going to go get that while you talk.
All right.
Be right back.
Sounds good to me. All right. Well, anyhow, we're new at this YouTube video podcast thing. We ask you to be gentle, but, give us your feedback and see if you think this is something that you'd like us to continue, because we are, just sort of figuring this out. Now, even though this is a new video podcast, we have been on YouTube at the Dr. Bones Nurse Amy channel for quite a long time. I hope you'll subscribe to our channel if you like our videos. Also, we are on, where are we at? We're on Facebook.
We were on Parler, but there is no more Parler.
I know, that is pretty crazy.
We're on MeWe.
We're on MeWe. We have our group is called Survival Medicine on MeWe.
And you don't have to do capitals. What you have to do when you search on MeWe, it's not terribly user-friendly yet. Search in it, and then your first results will give you members. So what you have to do is look over to the left side and go down and click on groups, because the first results is members, and obviously there's no one named Survival Medicine. So go to the second search, which will say groups. When you push on that, Survival Medicine will be the first result.
So feel free to join our group there. We also have a group at preppernet.net. That is Dr. Bones and Nurse Amy, it's called. Yep. And that's a great place to ask questions, and we support the folks of PrepperNet.
It's really growing.
Yeah, it is growing.
Really growing a lot.
A lot of different groups, and especially in North Carolina, but all over the country.
Super nice people too, really.
Good people too. You can find our audio podcast at blogtalkradio.com. And
that one has 10 years, over 10 years.
Yes, and of course our website at doomandbloom.net. Oh my God.
You know what? We want to emphasize the bloom.
Yes.
So maybe we should change it to bloom and bloom.
Bloom and bloom.
Bloom and bloom.
Or boom and bloom. Who knows? Well, we're actually
have
here.
More hot coffee here. Burn my lips.
This is actually a show that's going to talk about survival medicine. So you're going to get more than just a conventional medical wisdom from us. You're going to get a lot of unconventional medical wisdom, especially on today's show. So whatever it takes to make you medically prepared, that is our mission. So We are actively licensed medical professionals. We'd like to keep our licenses, so you have to listen to this.
To this disclaimer. All information and opinions voiced on the Survival Medicine podcast are for entertainment purposes only and do not represent medical advice for anything other than post-apocalyptic settings. We strongly urge our audience to seek modern and standard medical care whenever and wherever it is available. Please.
That's right. Hey, you know, it's 2021, and over the last year, we've seen the most productive producer of fish antibiotics, something that I've written about for many, many years, actually stop manufacturing their products. That was Thomas Labs. And this is all probably related to pressure from the FDA, which has stated that they are increasing their stewardship, whatever that means, of animal medications and other veterinary equivalents in the future. And they have already started doing that. This, they say, is because of antibiotic resistance issues, and sure enough, there are a lot of issues with antibiotic resistance, and we have to definitely deal with that. By the way, 80% of antibiotics are not actually given to humans, but are given to food-producing livestock. And the funny thing is that it's not given to them because they got an infection and they needed an antibiotic. Yep. It's given to them because for some reason, antibiotics they've given the food-producing livestock makes them grow faster and get to market sooner.
Yep.
And there are countries that don't allow that, and I hope that we, like Denmark, and I hope that we, at one point or another, stop giving antibiotics to our food-producing livestock just to get them to
as a
make
routine,
a buck faster.
Is the problem is they're being given this on a routine basis. They're not being given it because they're ill or because there's a group of them that are ill and could transmit it. They're just being given these antibiotics on a routine basis. So they're cutting back on that practice, hopefully. So we'll start seeing a lot less antibiotic meat in our system and fish too. But I also want to add something about Thomas Labs. I did find out from fishflex.com, Cameron, wrote to us, and he said that the state where they have their manufacturing, or their bottling company, I should say, not manufacturing, told them they weren't allowed to be bottling these antibiotics.
All right.
So they got pressure, like you said, down the line, from the FDA to the state to them to not bottle it.
I knew it was political pressure, and a lot of that, besides just antibiotic resistance in general, is reports of people using these veterinary medications in normal times. And everything that we write about is meant for long-term survival scenarios when you're off the grid as a result of some terrible thing that's happened.
When people like us aren't around.
That's right.
Right? The doctors and the nurses and the nurse practitioners, because I can write prescriptions, are not around to evaluate you in the system that you're used to. We'll be off grid. So we really want to emphasize that these things that we talk about are not for right now. They're just not.
Antibiotics are not candy.
Right.
I mean, they're basically something that must be used judiciously, and they should be used under the supervision of a qualified medical professional if there is one around.
Right.
If there's not a functioning medical system or infrastructure because of some long-term, prolonged disaster, well, then that's different, and that's what we write about.
What are you going to do then?
That's right.
You either learn how to use them properly when you have to, or people will die. I mean, there's just the fact that antibiotics, modern medicine, has saved a lot of lives.
That's true. So you can save a lot of lives, possibly two, if you were the medic in a long-term off-grid situation by getting a copy of our books. The antibiotic book called Alton's Antibiotics and Infectious Disease, our survival medicine handbook. It talks about antibiotics, all the different types, what they cure, what they don't cure, what you can do if you're allergic to them, if you're a particular one, what you can do if you're pregnant, things like that. So we go through that in detail, and you don't have to buy our books to actually get this information. It's absolutely free on dozens of articles at doomandbloom.net. Why am I?
I think we're gonna have to change the website
What
now.
is wrong with me? Yeah, we have to call.
But I do like
else.
that you're emphasizing the bloom. I will say this again.
Right.
I have no problem. It's just a little too late for us to switch that, but
all right.
we are doomandbloom.net.
That's right. Well, anyhow, Anyhow, since these are no longer available, at least from this particular company, we're going to talk about where you go from here if you want to have some of these in a you-know-what-hits-the-fan situation.
Right.
So everybody who might be the end of the line medically really needs to have something that's going to be able to take care of infections. This is important. I mean, I'm talking about situations where the ambulance is heading in the other direction, the rescue helicopter's not on the horizon. And if you can't imagine something like that happening, well, neither can almost everyone else. That's the thing. But it can definitely happen. It can happen anytime, anywhere. If the death rate from COVID was 10% instead of less than 1%, it probably would have happened already.
Oh my gosh.
That's actually a pretty interesting question. What do you think out there would have been the percentage death rate?
Scary.
What's the percentage death rate do you think out there would have caused our modern medical system to collapse, that would have stressed the infrastructure so much that we would be pretty much, in the Walking Dead territory?
So, if you want me to answer that, I'm going to say it's definitely not 10%. I think it's closer to probably 5%.
Really?
Yeah. Only because if you think about the hospitalization rates at 5%, our hospitals would have been overwhelmed. Mm-hmm. And what happens is it would have just sort of fallen in on itself, because as the nurses and the doctors who originally weren't sick become sick.
Yes.
And it spreads. Thankfully, most of them who did become sick didn't pass, but 5% of them are now also the patients. And so now you have less ICU and doctors and nurses. I mean, you can have a labor room nurse, but she might not do real well in the ICU taking care of a COVID patient. Right. So then you've got to cross-train all these people. That exposes even more people to the disease. Even more people get sick, overload the hospital even more, till eventually it just can't sustain itself. There's not enough healthcare workers to take care of the number of patients, or even the number of beds or ventilators. I mean, what we're seeing in, I think it's Brazil, in some of these towns, particularly one of them began with an M. I can't remember. Manaus.
Or I may not be pronouncing that right.
They had a meltdown. They literally had a meltdown. The hospitals became overwhelmed. They couldn't accept anymore. They ran out of oxygen. If you can imagine a hospital with people who need respiratory help running out of oxygen. And you can look it up. There are horror stories out there of nurses and doctors watching patients just die, and there's nothing they can do.
You have to have a system to deal with the dead bodies too.
Right.
And you have to have personnel to deal with that. Things that we don't have here.
Right.
Obviously, you would have to actually put something like that together at a time when there were a lot of people sick, and it just would pile up.
So my feeling is it probably only needed to be 5%, because if it happened with 5% of our nurses and doctors who were already becoming overwhelmed, I mean, it just, you have too many patients and not enough medical staff, so that leaves people outside. Mm-hmm. I mean, that leaves them in the parking lot, or just take them back home. There's nothing we can do. We don't have a place to put them. We don't have a ventilator. We don't have oxygen. We don't have anyone to look at your loved one whatsoever. I do think it only needed to be about 5%. Knock on wood. As bad as COVID has been, and we're certainly not going to, say that it hasn't been terrible for a lot of people, it could have been, and I hate to say this, it can be possibly worse. If this thing mutates, we talked about mutation last show, but if this thing mutates into something not only more highly contagious, because it's already done that, mutates into something that's more deadly, and we get a 3 to 5%, we get close to there. This is a disaster beyond what anyone can possibly imagine.
Okay, so back to antibiotics. About a decade ago, I was the first physician to write about the storing of these fish antibiotics and bird antibiotics, and using them as a tool for the medic in long-term survival situations. Okay, so I believe that then. I believe that now, even though the supply of them is no longer from the same distributor. We're going to have to figure out a way that you can still have some of these on hand in case of infections in a prolonged situation. This only matters if you believe that there is something that may come down the pike that may put us and just knock us off the grid because of some loss of rule of law, perhaps, or some major, huge disaster that could possibly occur. And,
or a completely different virus.
right.
Or a completely different bacteria that we've never dealt with. The problem for the human population is that these things that are happening are different than what we've ever experienced before.
That's true.
When we have viruses that are similar to things we've been exposed to before, we have some immunity, some form or level of immunity.
That's called antigenic drift. Okay, now go ahead and then tell us about.
So, if the virus that we've been exposed to before, had infections before, doesn't move too far away from the original virus, our bodies recognize it and say, that's not exactly what we've dealt with before, but the soldiers, the immunity system, have some experience and they're going to go out and fight. It's not the same enemy, but it's a similar enemy. They're cousins. We'll say that's a cousin.
Right.
The problem for humankind is when we have an exposure to a virus or a bacteria, which can be lethal. Obviously, if it just gives you a cold, who cares? But, has some lethality that we've never had exposure to. Nothing similar to it at all. And then it starts going through the population.
Or a previous virus that has shifted
So
significantly
much, right.
because of mutations. That's called antigenic shift.
So then it's not a cousin anymore. It's a sixth cousin.
Distant relative.
Sixth cousin, if you can imagine all of those generations, if anyone's done their ancestry. So we're lucky that the virus that we're getting exposed to now, if it does change, hopefully it won't change very much, even though it's more contagious. Hopefully COVID will not become more deadly. That's our hope.
Right. So anyhow, with antibiotics, I believe then, I believe now that you need to have a supply of this stuff because bacterial issues, viruses, in my opinion, are going to be the pandemics of the future.
Yeah.
Okay. And the problem is that when we lose a modern, advanced medical infrastructure, if something like that happens, then bacteria are going to come back. There used to be malaria epidemics in places like Savannah and New Orleans and things like that. Yellow fever, things that you would expect in third world countries used to be not that uncommon.
Right, they were here.
In the 18th and 19th century in North America, in the United States. So these are things that can happen, and you may not be able to control the death rate from a brand new virus, but dying from bacterial infections that we've been exposed to before, that we've known about for hundreds of years, just because we have been knocked off the grid, that's unacceptable.
Yes.
Because we have antibiotics. We have the possibility of getting antibiotics.
Store them.
That's right.
Preppers.
Okay, so you
Be prepared.
So you're the medic. You're the medic. So accumulating over-the-counter drugs, okay, that's easy. But prescription medicines, not so. Even if you had a sympathetic doctor, it would be difficult for you to be able to get more than just a small amount of medication. Certainly not enough to be the caregiver for a survival community, off the grid in times of trouble.
Can I give the little spiel about how you can get a little extra from your prescriptions?
Oh, okay, yeah.
So you have prescriptions, and there is a time when you can go get them refilled that your pharmacy will allow you to then have it billed to your insurance company. That is not always known. Ask your pharmacist, when can I come back? Because it is not on the 28th or 30th day. It is before then. So if it's at the 21st day, you go get the new prescription. Take those 7 that you've just saved, because now you've got a whole new bottle. Go ahead and take those 7, because those are going to be the oldest. Then after you've taken those 7, then you break open the new bottle. When you have taken now 2 weeks of that new bottle, because you already had a week from the previous bottle, that's another 21 days. You can go get the 3rd bottle. But when you get the third bottle, you will have only taken 14 of that second bottle. So we're going to call it 28 days. So you've got another 14 before you even break into the third bottle. If you can imagine doing that every 21 days, because that's when your insurance allows you to go back and get a refill, you're going to start accumulating in the future bottles that you haven't even opened up yet.
And that's
because you're still taking your older pills. But always take the older ones first, so that what you have, if something collapses, is the freshest possible medicine.
All right, now that not only includes antibiotics, but includes blood pressure medicine, just about any other
cholesterol medicine,
just about any other
diabetes,
kind of
metformin, sure, absolutely.
Right. So I wanted to say that there's going to be a larger incidence of infection when people have to fend for themselves. I think that this is pretty clear that it's been a while since you've had to blaze a trail through the jungle.
Are you waving around a blade?
I'm waving around a machete. Or had to
that one's really sharp.
Chop wood for fuel. It's probably been a while. Look, I actually cut myself.
Did you?
No, I didn't.
Don't do that.
I'm kidding.
Then I'm gonna have to show them how to stop hemorrhaging.
Yes,
that's for another show. Soon. But not now.
So what happens? So for city folk, or suburban folk, who don't do this on a daily basis, maybe you do that out there on a daily basis, but for folks that don't do that, well, especially if you do it without hand protection, you're going to wind up having injuries that you as medic are going to have to deal with. And those injuries can indeed become infected, right? If you don't do anything about them, most of those wounds are going to be incurred outdoors, maybe in the wilderness, and they're going to be dirty wounds, and they have the potential to be infected. I should mention, I guess, what a wound infection looks like. A wound infection usually takes the form of redness, heat, and swelling. So those are the things that you'll see. It takes a day or two really to show up, which is why some doctors will wait a couple of days for an open wound to sort of manifest whether it's going to turn out to have an infection or not. And they won't close the wound right away. They do what they call a delayed closure. If there's no redness or swelling after a couple of days, then they'll close the wound. That is a delayed closure. We've talked about that on previous shows.
I just want to mention a couple other ways you can get injured easily. Kitchen injuries. I mean, and that's today. So when we do talk about the bleeding, how to stop bleeding, we show you guys all of the techniques for that. That's going to be used today, or even car accidents you come upon. But in addition to chopping wood, I think of the daily meals that are going to have to be made. All the injuries that are going to happen between burns and
like
right, and then butchering animals. Think about that, and just so many things that we're going to be doing outside. That, I mean, I pretty much think I'll cut myself every day. I do that in the kitchen anyway by accident. In modern times.
That's right. So redness, swelling. As the swelling gets worse, the skin starts looking shiny. It looks red. It'll be warm to the touch. If you have an injury on your arm, one arm, let's say, if you feel the other arm, you know that the red area on the near the injury or in the injury is going to be significantly warmer. These are things that you're going to see happen, and as an infection gets worse, this kind of infection, which is often called cellulitis, a soft tissue infection, gets worse, it often travels towards the torso. And that's why it's a good idea to take a felt tip pen and make a mark of the borders of the redness and sort of follow that. And as time goes on, it's either going to get bigger if the infection's getting worse, or it'll get smaller and go away as the infection gets better.
Right.
So these are things that are important for you to know, and you should be able, if you're going to be the medic, be able to recognize a wound infection. I think everybody should anyhow.
Yep.
Now, if you had antibiotics, you could treat an obviously dirty wound at an early stage, or infection at an early stage, and improve the chances that the healing will occur rapidly and occur completely.
Yep.
Now, there are a lot of rugged folk out there that are likely to tough it out and say, well, I can get over this. And indeed, sometimes they will, but doing that just really gives time for the infection to get worse and eventually spread to your blood. If that happens, the end result is not good.
So don't ignore the signs of
That's right.
infection. Just because you're a tough person,
That's right.
the infection doesn't care how tough you are.
So-
It'll get you just as much as it'll get a 5-year-old,
That's right.
right?
Bottom line, if you have access to some antibiotics, that problem can be nipped in the bud before a tragic outcome occurs.
Right.
Now, recommending alternative sources of antibiotics is pretty contrary to standard medical advice, and so it's only appropriate when help is not on the way. I've said that 4 times already, and I'm going to...
And my disclaimer, and I
there you
said
go.
it too.
A million times. Now, you can get small quantities of antibiotics if you're willing to tell the doctor that you're going out of the country and would like to avoid things like traveler's diarrhea.
Although who's going out of the country these days?
Yes, that's right.
We're all stuck in our houses. Ah!
Well, now we apparently can go to a number of different countries.
Oh, really?
Yes.
Well, good luck with that, folks, because I ain't leaving. I am not getting on an airplane. Not if I have to wear a mask.
You might not know, by the way, that some forms of traveler's diarrhea are actually treated or prevented with something called bismuth subsalicate.
Ooh, Pepto-Bismol. Here, let me hold that.
Pepto-Bismol,
So you can talk.
Vanna White. And Pepto-Bismol indeed has been used to prevent traveler's diarrhea. If you take the equivalent of 2 tablets 4 times a day, and while you're on a trip to a at-risk country for that kind of thing, it can decrease the incidence by up to 60%. So it might be it sounds too good to be true, and in a sense it is, because people who take that amount of Pepto-Bismol for any significant length of time probably get pretty bad constipation, to be honest. But indeed,
Oh, yeah.
that's something
That would make
that's
sense.
another over-the-counter option to prevent that particular problem. Now,
I'd rather have the constipation, though, than the illness. I tell you what.
oh yeah, well,
I'd rather be going less than going more. How's that?
okay, gotcha. Yes.
See, simple ways to put that down. Thank you.
Let me put this down. I should say also that you can get Tamiflu, or maybe the newer one-day influenza drug, Zofluza. Now that's these are antivirals that work only against influenza, but at the beginning of every flu season, if you ask your doctor for a prescription for you and members of your family, then usually they really don't have too much trouble with it. And the reason why is because you have to use that stuff within 48 hours of getting the first symptom.
Real quick.
Not everybody can get in to see their doctor within 48 hours.
Right.
And so for that reason, most doctors really aren't that troubled by giving you a prescription for that. The only problem is that anybody who thinks it's going to cure COVID-19, that is a mistake.
Yeah,
It doesn't do a
work.
darn thing
No.
for that. So that's something that's important. And of course, also, if we go back to antibiotics, remember antibiotics only work against bacteria. They don't work against viruses at all.
Right.
So a lot of these medicines are very, very specialized. Antibiotics are bacteria only. Tamiflu and Zofluza only effective against the influenza virus.
Specifically.
That's right. And there are other medicines like acyclovir, which is specific for herpes, virus, things like that. There are antivirals that are specific for individual viruses.
Right.
That's right. Now, so how do we figure out all this about fish antibiotics? For years, we kept tropical fish in aquariums, and we actually grew tilapia in ponds. We were pretty good at it, as you can see. And we really, when we got interested in survival, we looked at some of the medicine that we gave our fish and our birds. We have a parrot. They get bacterial infections. Fish get fin rot. The parrot can actually get chlamydia, believe it or not. And we use antibiotics to treat them whenever they got something that was bacterial in nature. And so we had something called fish mox on hand. And so we took a look at it when we realized that without antibiotics, that there were going to be some unnecessary deaths in true survival situations. And so when we looked at it, we looked at the ingredients, and there was exactly one ingredient. It was amoxicillin, 500 milligrams. Now, there was nothing in here that made your scales shinier, or nothing in the bird stuff that made your feathers longer or more colorful. Basically, it's just one ingredient.
Right.
It's the antibiotic itself.
Right.
So that was sort of interesting, but what was most interesting is that these medicines were only made in human dosages. This was 500 milligrams, which is the dose you would give an adult male or an adult human. So why, we wondered, would a guppy, for example, be required to take the same amount of amoxicillin as a human adult? The theory was that, well, you put it in the water and the water
dilutes it,
and
right,
that
disperses around.
So that's why it works. But a decade ago, when we first started writing about this stuff, there's almost no place that you could find any kind of formula for that. In other words, they didn't tell you to use a certain amount in a fish bowl as opposed to using a certain amount in a 200-gallon aquarium. And so we found that to be a little unusual. And so we decided to do the acid test. We got a
few bottles.
Few bottles of different human antibiotics, because I'm a doctor, I can get them. So, and I found the human antibiotic was the human amoxicillin, 500 milligrams, made by Deva Pharmaceuticals, was a red and pink capsule with the numbers and letters WC731 on it. And I opened up the Fishmox, the Forte variety, which was the 500 milligram variety, and it was a red and pink capsule with the numbers and letters WC731 on it. In other words, it was identical.
It's the same thing.
Absolutely identical.
The FDA will not let a manufacturer of a drug have the same colors and letters or numbers identifying it, because if they have an overdose or there's some kind of reaction to a medication, whatever it is, they need to know who manufactured that. So Deva Pharmaceuticals was assigned or applied to have a red and pink capsule with those letters and numbers, and no one else is allowed to use that. So there's no fish manufacturer who is producing a red and pink capsule and putting WC731. They're not allowed. That is illegal.
So it was our opinion that they probably came from the same batches, manufactured at the same place, and just some went to human pharmacies and some were bottled for the pet trade.
Right. They put them in a bottle, they stuck a label in them.
Exactly. And over the years, readers of ours that worked in either the pharmacy, the human pharmacy or veterinary pharmacy field, actually,
and research and development. We've met lots of people in drug research and development companies
have confirmed this. And so how about that? Now, that's not to imply that all antibiotic medications met our criteria. There are a lot of dog antibiotics and cat antibiotics and livestock antibiotics that have additives that may cause ill effects in humans if they took them. Now, you really need to look only for veterinary drugs that have the antibiotic as the sole ingredient, and that antibiotic has to be made only in human dosages. That's important. You'll find a lot of this information on our website and our books, of course. And we have a book specifically on antibiotics, but also the regular survival medicine handbook has it. Now, you might say, well, they're not stored the same way. Honestly, they have to be stored the same way. People who have pets who are given medicines want those medicines to work. People who are human want their human medicines to work. And if they come from the same batch, they really shouldn't be stored any differently. You want to store them in cool, dark, dry conditions, whether you're it's a human medicine or a medicine for your pet. You don't want your pet's medicine to go bad sooner than any other medicine, right? So that makes absolutely no sense. But there's been a lot of controversy regarding these medicines. People taking these medicines in normal times, not a good idea. Not a good idea.
Exactly.
This only applies to long-term survival scenarios, but as a result of people doing that, the original distributor of these drugs, Thomas Labs, eventually stopped manufacturing them.
Yes,
now,
the FDA came down upon them. Their state said they weren't allowed to bottle.
There you go. So,
but now we have alternatives.
Right, there are other brands with names like Aqua, Fishbiotic, Fish Aid that have, at least when this video was shot on January 23rd, 2021, that filled the void, and they have their own set of medicines. You have these as options. And so, Amy, I'm going to hand you some of these and just tell us what they are, okay?
Okay. All right, so we have metronidazole or Flagyl.
Okay.
And this one is the 500 milligrams, and this is by Fish Aid. I'm going to hold it up here. I think we're focused right about between our heads here. There's one of them. Again, Fish Aid.
And here is an aqua version.
And so Aqua, which is the other company, uses half of the name of the antibiotic. So they call this Aquazole. So these are the same capsules in here, possibly by different drug manufacturers. Remember we talked about the FDA assigning letters and numbers and colors to these. We haven't opened these particular ones up yet, but they could be from the same exact manufacturer. I do want to just quickly mention, we're going to go through more antibiotics. I have one that's not an antibiotic. It's actually an antifungal. And the common name for this is called diflucan. The generic name is fluconazole. And this comes in 100, these are 100 milligram, right?
Fluconazole, yes.
Okay. So these are the 100 milligrams. And if you look up diflucan, the 100 milligram, you can take it as a one-time dose for one day.
Now this is Z-Pak in veterinary form. It's made by Aqua.
Aqua Zithro.
And it comes, this is 250.
This is the 250.
Yeah.
This is exactly what's in a Z-Pak. If you've taken a Z-Pak, it has 7 capsules, 6 capsules. You take 2 the first day, so you do a loading dose of 500, and then for each of the next 4 days, you take 1. So if you take 6 of these, you end up with your Z-Pak.
Now, both Aqua and Fish Aid, and I think Fishbiotic too, have versions of cephalexin. Cephalexin is a popular antibiotic, Keflex, and you can find this here, and this takes the place of Fishflex from the old Thomas Labs.
So the Fish Aid cephalexin comes in the 250 and the 500, and the Aquacef only comes in the 500. So this is the adult dose. The 250s were the pediatric dose.
Now, this is what we found. Now, this says Forte on it, just like the old Thomas Labs did for its stronger version. So maybe there is a lesser version of Aquacef. I'm not sure.
They might have just been sold out at the time.
Right. This is the sulfa drugs, Bactrim, Septra. This is a combination drug, sulfamethoxazole, trimethoprim. That is used commonly for urinary tract infections in humans, and so this is something that is a double strength. Yeah, so this would be Bactrim DS or Septra DS, because the regular is 400 of sulfamethoxazole and 80 of trimethoprim.
Gotcha.
Let's see what else we got here. We have fish doxycycline. So doxycycline is a very popular antibiotic, one of the most common antibiotics prescribed today. It's 100 milligrams.
Right, 100. Standard adult dose.
Standard adult human dose.
And this is by Fish Aid.
Okay, let's see. We went through this one already. Here's fish amoxicillin by Fish Aid.
And this is the 500. I believe you have one that's 250 also.
Right, we have a 250, and it comes in 250 and 500. This is clindamycin, which is the human version is called Cleocin or Lincocin, and this is an important antibiotic to have.
By Fish Aid.
By Fish Aid. There's more amoxicillin. Here is an Aqua.
This is probably this is the 250. This is the pediatric dose.
This is the Aqua version of Cipro, which is another popular antibiotic. And
Aqua Cipro.
And this is the Fish Aid version of Cipro. And we have 2 doses of Aqua Cipro too. Here's the Forte version.
Yeah, we actually have Aqua Cipro comes in the 250 and the 500, and the Fish Aid also comes in the 250 and the 500.
And then you have the old standard penicillin comes, and Fish Aid has penicillin in 2 doses, 250.
Right, pediatric and adult. 250 and 500.
So those are some of the ones. There may be other ones that are out there. I'm not sure as of yet. I haven't done all the research to see what's left that's out there for you, but it's important for you to know that there's going to be volatility in the availability of a lot of these medicines over the next few years as the government increases its control in the future over these types of medicine, and of course your ability to access them. Of course, anyone can be allergic to any one of these medicines, but it's very unlikely that you'll be allergic to all of these medicines because they're all different. A lot of them are different families of drugs. People who are allergic to penicillin, however, do have about a 10% chance of being allergic to cephalexin. They're in the same family, general family of drugs. But those people can take azithromycin, or they can take doxycycline, or they can take clindamycin.
Right.
So each one of them also has its own side effects. It has its own rules with regards to using it during pregnancy or for children.
Right.
Some of them have significant side effects. So, like I said, this is not candy. These are serious things.
Right.
Cipro, for example, can cause significant nerve and muscle, nerve, and tendon issues. And so this is something that should only be used judiciously in normal times, of course, under the supervision of a medical professional.
So I just want to mention that we're not really telling you how to take these antibiotics, that this information is available in videos under a playlist that I have in YouTube called Antibiotics. So that information, you've done many different videos
Right.
on single antibiotics, side effects, how to take it, what are you taking it for, how long to take it. So if you want to learn individual information on antibiotics, we do have YouTube videos. That's going to be one of our 4,000 topics
Yes,
that
that's
we will
right.
be speaking about in the future. So we will do
Right.
more show and tell about specific antibiotics besides the YouTube videos you've already seen.
Now, I just want to say that I'm not just telling you to use this
No.
at any time other than a survival setting.
Right.
But I will say that I have used them
Yes, we
myself.
have.
Because I wanted, before I make a recommendation of any type, I certainly want to do everything possible to make sure it is safe. So
we're the research. We're
world's oldest guinea pig.
We're the guinea pigs,
So-
and when we open them, we go on to websites where we can tell where this was made and who it was made for, because like we spoke of, the FDA has specific colors and letters or numbers assigned. You can look those up.
So what about foreign pharmacies? You need prescriptions for Canadian pharmacies, but there are a bunch of Indian and other countries that have pharmacies online that you can get a lot of these drugs at. Now, I don't have any experience with them, so I really can't tell you they're good, they're not good. I don't know if their standards are as good as ours. All I can say is that I believe that many of these medicines that we have here in aquatic form are indeed exactly identical to the human version. I can't say that necessarily for other countries' pharmacies. It's very possible that they're just fine, but I don't know.
And also other animal medicines.
Yes.
There are manufacturers that make horse medicine, has nothing to do with human. It might have some human ingredients, and they've done something special because of the horse's weight or something.
The dosage can't be the same.
Right, it's not going to be the same, but obviously they could have other ingredients too. So
Right.
there are manufacturers for dogs, cats, pigs, cows, horses. Some of those animals do use some medicines that are made for us, but they also have their own manufacturers. So we cannot tell you something that's made for a horse is going to be just fine for a human. We don't know.
Now, other references that you can go to besides our books and our website, of course, would be online at drugs.com, rxlist.com. There are a number of other useful sources. We do recommend you have a hard copy of some manual, some drug manual, especially the ones that have pictures, because if you were on the road, some disaster has occurred, and you're basically in a off-the-grid setting, an abandoned pharmacy may have medicines that you can look up and
Right.
see what they're good for.
PDR.
Right, exactly.
Physician's Desk Reference
Right,
is a
they
really
have
good
a digital.
one.
That's a digital form also.
Find an old one on eBay.
They used to have actual physical books. Now
Oh my
they're
gosh,
all
they were
online.
huge. Remember, they were like
Yes,
this
like
big,
2,000
and
pages,
every
yeah.
year they would come out with a new
Yeah.
one. I can't imagine what it cost to print that. Imagine all those color pictures.
Oh my God.
Ooh.
It was crazy. So if you're still skeptical about all this, I don't blame you. I don't blame you at all. This is something that's way outside the conventional medical wisdom, and we've spent an entire show telling you something
So-
that we would never tell you to do
Right.
at any other time.
Right.
But think of this. A disaster has occurred. It's knocked you off the grid. It's sent you on the road. Your family is performing all sorts of activities to which they are not accustomed to. Okay? You send your son off or your daughter off to chop some wood. They injure themselves. In 2 days, that injury starts becoming red. They start getting a fever. The redness and swelling starts to climb up their arm or up their leg. You have a bottle of fish amoxicillin. Are you going to use it? I'll let you decide.
I will. I'm going to save your life.
Thank you.
Because I love you.
And I appreciate it. I love you too. And that's all the time we have for this episode of the Survival Medicine Podcast. We hope it did not make you nauseous. That was clinical trial 2. And if it did, please let us know. If you liked it, let us know too in the comments section below. Have a wonderful, wonderful week. We'll give it a try next time.
Thanks for watching. Bye-bye.
Hey, please consider supporting our mission to put a medically prepared person in every family by getting some of the quality medical kits, individual supplies, and personal protection gear available at store.doomandbloom.net. Also, subscribe to this channel and other social media, including our new group, Survival Medicine, on MeWe. Thanks again.